Hello and welcome back. We are so excited to kick off our Spotlight panel sessions. Joining me today is Joseph Wu. Joseph is an epidemiologist, a researcher, and an expert in surveillance systems. He is one of the pioneering researchers to assist the development of the nationwide emergency department-based syndromic surveillance system during the post-SARS period in Taiwan. For more than a decade, he has been living in Malawi, first as a country representative with Luke International Norway. He is also a lecturer at the Mzuzu University and the University of Livingstonia, and currently serves as the acting manager of the Public Health Emergency Operations Center for the Ministry of Health. In addition to providing technical support to the epidemiology department of the Ministry of Health in Malawi, Joseph also has worked to support an automated surveillance system through the Ebola response plan funded by the World Bank. In 2019, Joseph was included as a member of the Experts in Digital Health and Innovation by the WHO and is currently pursuing his PhD at the University of Oslo. Welcome, Joseph. We are so excited to have you here this morning.
Yeah, thank you, Nicola. And good morning, good afternoon, good evening to all the audience here. It's my honor and the pleasure that I have this opportunity to share some of the perspective and observation from Malawi. As Nicola mentioned, currently I'm working with the Ministry of Health. However, for today's talk, I will speak more or less as an acting researcher from the field rather than representing the government. So that is a very important point. So the topic that I'm going to share is the global health security from One Health and the digital development perspective, and the challenge and opportunities that exposed during the COVID-19 pandemic. I understand that our goal is not really focused too much on COVID, but actually COVID gave us a very good opportunity to understand the situation. Now from a small country in Malawi, and then we can even further expand it to the global spectrum. Yeah. So to begin with, I will start with a brief concept about when we are talking about the global health security. What do we mean? So based on according to the WHO standard and the definition, the global public health security is more or less like an activity that require both proactive and reactive way to minimize the danger and impact of acute public health events that endanger people's health across geographic region and international borders. So that is actually encompass the infectious disease and also non-communicable disease and also all types of hazard. And then based on the CDC definition, the global health security is the existence of a strong and a resilient public health system that can prevent, detect, and also respond to infectious disease threats wherever that occurred in the world. So over the past 2 decades, actually, there are some key instruments that have been developed, both from WHO and also the global society, that including the IHR, the International Health Regulation, which was revised in year 2005 after the SARS outbreak, as well as the avian flu. And then also there's a joint external evaluation tool developed by WHO to help the member states to assess their country's health security status. And also there's global health security agenda, heavily supported by CDC, and also a global health security index for member states to understand the situation. So what kind of health security that we are concerning or we are dealing with right now? So when the whole world is developing, actually we are facing the types of nature health threats. Maybe it's coming from the nature environment because people are having more and more interaction with originally that people may not go into, like the rainforest, or having more interaction with the wildlife, or it can be man-made, like coming out from the biohazard, bioterrorist kind of attack, like the unfortunate event of the anthrax attack in year 2001. And then the health threats can be directly impact the human race, or it can be indirectly. For example, the climate change may change the whole ecosystem and the dynamic of the mosquito, which make the malaria and also other arthropod-borne disease become more widely spread worldwide. And then also the kind of health threats we are dealing with, it can be human infectious disease or zoonosis. So for example, the coronavirus or avian flu or Ebola, these are also more considered as like crossing the species from animal to human. So if we look at the whole threats that we observe and we are dealing with worldwide, actually we will be able to understand and find out that actually the health issue, the health security issue is actually interlinked and interconnected and intertwined with the human health, animal health, and the environmental health. And that is where that is where we have the One Health approach as a strategy to strengthen the IHR implementation and also enhance the whole global health security. So the whole concept of One Health is that we take care of the human spectrum, the animal, as well as the environmental health issues into one consideration. So this concept is not a very new concept, but after more and more emerging infectious disease and the new public health threat and security threat, that is where we see the importance to have this One Health approach to deal with our health issue and the health threats. So actually, just right before the SARS-CoV-2, the whole COVID pandemic started, in year 2019, there's a group of leading researchers worldwide gathered in Oslo and come up with the Lancet One Health Commission and propose a much comprehensive framework as a preliminary starting point, like how we will be able to implement and then trying to practically implement the idea and the concept of One Health approach into the whole global health security development. However, unfortunately, we all know that COVID hit, and actually we haven't been able to really develop a very good and resilient system in most of the country in the world. That's why we are facing a very difficult situation right now. And also there's other important tools and initiative in related to the whole global health security. The global health security agenda, a kind of network organization type of structure, helping all the different members, including the governments and also the governmental organization and INGOs to join together and trying to strive to enhance the national health security. And then the JE, which I mentioned earlier, developed by WHO, is a tool for member states to really assess and understand each country's national health security situation. And then based on the JE report and also other information, there's a Global Health Security Index developed by Johns Hopkins and also other partners, provide us a full understanding and a much comprehensive spectrum of most of the country in the world. How prepared are we in terms of the global health security? However, in all these tools, people may start wondering what would be the role of the digital development. Because in all these different instruments and the tools, actually the information, communication, and technology were mentioned in part of the document or the tool. However, there's no clear understanding or the clear guidance in terms of the role of the digital development in all this global health security. And that is where I think from Malawi experience, we might be able to learn something. So then I will come into the health security context in Malawi. So Malawi, our leading role of the national health security is the Ministry of Health. And then according to the legislation, the IHR 2005 focal point in the country is the Public Health Institute of Malawi. We call it FIM. So FIM is constituted to serve three important functions in the whole health security. One is the leading directorate in charge and responsible for surveillance activity. And then 2 is the National Laboratory Service. And then the third one is related to the research and the capacity building. And Malawi as a country, we adopt the One Health approach to deal with the health security issue, which is under review of the National Public Health Act, will be included in the national government. The national policy. And then in year 2019, Malawi joined the Global Health Security Agenda with the formal application and got formal acceptance as a member, official member. And the same year, in year 2019, Malawi conducted the first joint external evaluation. So because Malawi did this JEE in year 2019, which is very interesting, we did that in early of the year in February. And then that is where the Global Health Security Index were able to analyze and also obtain the information and the data from Malawi. And at the time when we were first assessed with the Global Health Security Index, Malawi, our nation, our world ranking is 154 out of the 195 countries that be included in the analysis. So we can see it's like a least prepared in terms of the national health security. It poses a big threat to the country, to the government. So actually something already started happening in year 2019. So even when the COVID-19 hits the country in year 2020, Malawi is not like completely unprepared for any forthcoming epidemic or outbreak or pandemic like the one we are encountering now. So what we observed before the pandemic was announced in March, actually in the country, in the Ministry of Health, we already see that worldwide, globally, there's a lack of transparent and timely information for the Ministry of Health to make a decision. So at the time, we are trying to gather a lot of information. And also in year 2019, when we understand that we have some challenge in terms of understanding this health security information from different sectors. Actually, a WhatsApp group, One Health Surveillance WhatsApp group was created way back in year 2019. So when COVID, by the time we don't know it's called COVID, when the disease starts having the rumor coming out from China, people already start discuss about it, but we don't have much of the information. And then also the health system is kind of unprepared because we don't know the scope of this outbreak or epidemic, or by the time we are not expecting really understand like whether or not this will become a pandemic. So the health system in terms of the response is not fully prepared. And then of course the biggest challenge in the country is our resource is not adequate. So although so when we are talking about the national health security, we are talking about the prevention, we are talking about the detection and talking about the response. But the resource that we are having in the country is really limited. And also we are facing the contextual and the cultural challenges to implement surveillance and the infection prevention control measurement. We are dealing with the infodemic because at that time there's a lot of rumor and a lot of false news falling around. And then amidst the whole COVID pandemic, when we know like, okay, now this is a pandemic we're dealing with, and still we are facing the challenge like lack of trustworthy and timely source of information to know the risk globally. For example, at the moment, we still, we are assessing each country, each location's risk based on the information that we can gather worldwide, and also the virus variants information. We are still relying on, not really from the traditional source of information, but we try to gather all the information as much as possible. And also locally, we are, the biggest challenge right now is lack of ability to monitor the mutation of the virus. So that is from the biology pathogen level. We are not able to really monitor the whole mutation status, although we may, we are trying to do that, but the challenge is that with the limited resource, it's very difficult to do it. And also the whole contextual and the cultural challenge is a dynamic situation. We are dealing with the other type of myth and the mistrust nowadays, especially in related to the vaccination program. So if we look at the whole epidemic curve in the country, in Malawi we experienced the first wave of the COVID pandemic, beginning from the late April up until the end of September. So the first wave, we are experiencing that, and then at the same time learning from this first wave and trying to control and maintain the status. And then during the October, toward the mid and the end of the December, that is what we call the low incidence period. So actually in Malawi, we are controlling it quite well. And then just right before about the beginning of the Christmas festival season, we start having our second wave. So this is actually one way we are trying to monitor the situation in the country, not only just using the statistical data, but also trying to apply some statistical knowledge to tell us when is exactly we are expecting the new wave of epidemic coming in. So we're using a statistical method called Q-sum within the Ministry of Health, so that we are able to monitor and knowing like we are now dealing with the second wave. But as you can see, the second wave, although it's peak in January toward the end of February, and then the case start sharply decreased. And now we are more or less like in the very stable status. Cumulative, the data from yesterday in the country, we have 34,000 confirmed case, and also the 93% of them already recovered, and we are continue monitoring the new cases and the positivity rate. And then also from this kind of dashboard, this is from the public dashboard that we circulate in the public and also via WhatsApp. We'll be able to see a lot of information, and that is where the whole digital solution start coming in. So if we look at the, based on the COVID performance index, Malawi's pandemic response ranking, actually we are not doing bad. The last ranking we checked from January is we are ranking 27 out of 98 worldwide. So it pose a very interesting question. How come in our country, the Global Health Security Index ranking was not that well, but our performance in terms of responding COVID is quite nice. So why that? So from my observation as an action researchers, I would say there are three key aspects of Malawi's success. The first one is the system. The system includes the process and norm that exists within our health and also what we call the One Health system. And then the second important aspect is the digital development. We have a lot of infrastructure that is actually exists. And then the third one is the whole human capacity. So that is how we got a resilient national response result of the COVID-19 pandemic. So if I try to explain the health system, because in the country, we have the existing process and norm. As I mentioned, the One Health approach already adopted by the government and is rooted in the Ministry of Health, most of the personnel and management at the management level. And also as a country, we experience in responding quite a lot of potential health threats, including the cholera, the Ebola, and typhoid outbreak, etc. And also in the country, we have a functional integrated disease surveillance and response system, the IDSR, and also the port health system at the point of entry. These are all functional, and they continue functioning no matter it's before or during the COVID pandemic as of now. And also as a country, we have a functional IHR focal point with the One Health approach. So that means we have the members from the military, defense force. We have members from immigration, police, agriculture, etc., etc. So when COVID was announced as a national disaster, and also soon after that, it was announced as a pandemic, and then soon after the first confirmed case appeared in the country, the IHR focal point in the country activated to become a national public health emergency operations center, and we launched it in time and was able to start tackling the issue. And also we have functional stakeholder and partner coordination mechanism within the ministry that including the health cluster system and the various technical working group in each different response pillars. And the important norm in the country is that the government has an openness and transparency kind of culture toward the disease outbreak and the epidemic response. Then for the digital development part, we have quite a long history with the existing infrastructure and digital artifact in the country. We have a long-term commitment from various development partners and also from government. So personally, I witnessed how the whole digital system evolved from the ART-driven electronic data system toward the national health information system and start bringing the concept that introduced and guided from WHO, and then to nowadays, the digital health. And the Ministry of Health and the partners, actually, we are all learning and developing the digital health included in the whole national digital health strategic plan and also policy, is that we are developing the digital health in the country with the key principles. The architecture design principle, we're making sure that everything we design or everything we try to put in place, they fall under the architect. We design it before we start jumping into the artifact itself. And then the Ministry of Health and the partners all has the idea and the understanding of the importance of integration and the interoperability. And we use the user-centered design approach to design whatsoever information system or the digital artifact. And we follow the standards both internationally, and if they are not available, we develop the local standard and also trying to do the alignment for all the development. And also in the country, we have general improvement in terms of the digital infrastructure and the illiteracy. That is right before and even up to now is still ongoing. The whole connectivity is improving in the country, and also the young generations of the healthcare workers or the frontline health workers, they have more acceptance to the technology. So the architect design, as I mentioned before, this is the architect we developed before the SARS-CoV-2, the whole COVID pandemic started. So looking international, we work with the UNICEF to start developing the whole electronic IDSR system and using the concept of One Health approach. So before the SARS-CoV-2, actually, we already start developing the One Health surveillance system together with UNICEF, with the Ministry of Health. And the whole idea is to bring in the human, the animal, and also environmental health aspects and health surveillance data into the DHIS2 platform. And then having the interoperability to talk with the HMIS, DHIS2 in the country. So this concept and this architect was developed before the SARS-CoV-2. And soon after we know that SARS, the COVID pandemic started, with the project that we work together with the Cooper Smith and funded by Gates, the KUNICA, because mainly from KUNICA, we are supporting the Ministry of Health for the digital health development. And by understanding the importance of COVID and also the threats, we are delighted and very appreciate that Gates agreed that we can shift our focus toward the COVID response. And immediately we start trying to develop the whole COVID response digital health solution and the service architect. And that is based on the different response pillar and the section, and come up with the different types of software artifact and the information system. And so that means we have the system in place, we have the artifact that can be functioned, and also we have improved the connectivity, and some of the data hosting is not fully resolved yet, but we are moving toward that. So this gives us a very good opportunity actually to be able to respond and provide the data and the information to the whole country, especially in related to the COVID response. And so there are different and the various digital development and application were coming up during the whole COVID response. I will not go into the detail because I think my colleagues in the following session during the summit, either the colleague from Smith or from Kunika and also from UNICEF, if you see like a speaker is coming from Malawi, I encourage you to join and then to hear some of this story. But all to all is that we have a lot of different software or the application that have been developed, and also it's coming from the different partners. However, we are able to really integrate and moving toward the same direction, that is for the COVID response. And how do we do that? That is actually coming out from the human capacity. In the country, we have a readiness of skilled personnel and also having that zeal of togetherness to collaborate. So to deconstruct the whole human capacity, I use the angle of the health professions, which we have a lot of different partners. They have understanding and a knowledge in responding to the COVID or surveillance or lab or case management. And then we have a lot of digital development partners coming from various organizations supported by different donors or funders. But the important thing is that we have the bridge maker or translator that work in between these two quite distinct domains and be able to make this happen. So that is the whole function of the Kunika, one important function of the Kunika actually, because we at the same time serving the health profession and then at the same time serving for digital development. And that all for everyone is working under the roof of the Ministry of Health and follow the same vision and the guidance coming from the government. And that's how we were able to come up with the various solutions, but then all integrated and then coming out with the whole interoperability, functionality, and the ability to really make the data to be useful. So in conclusion, what we have learned from the COVID response from Malawi is that if we look beyond the COVID or saying like post-COVID era, the important thing for the whole digital development and also the global development is that we should try our best to invest in human capital. And through the COVID experience, we know that it is important to have in-country high-quality personnel, both within the Ministry of Health, like the role Kunika play, and also with the development partners. And the importance is like the in-country capacity is really, really critical, and that is how Malawi make it happen. And then the second important part in the post-COVID era, I think, is to enhance the whole One Health approach, especially the surveillance system. That is the detection ability. And so for example, the One Health surveillance platform that we develop, we customize, use in Malawi using the DHIS2. That is a good way to accommodate data, because in the near future, our goal is to be able to accommodate data also coming from the agriculture, animal, and also environmental source. And so that means we should try to urge to have the data coming from the human surveillance, that's the EIDSR, and having both passive and active surveillance in place, and then try our best to move from the manual type of reporting to automate. And that will require a lot of investment and development also at the community and the facility level EMR or HIS, Hospital Information System then. And also there's opportunity to enhance the biology and the AMR surveillance using the similar technology or digital development. And the similar thing we can try to apply to the animal surveillance. However, in this area is not fully developed yet. There's a lot of urge to come up with something similar. And then for the environmental surveillance, we can further even think about semi-auto or automate way to monitor the whole environmental data from water, air, soil, like sewage system surveillance is a quite good indicator for COVID surveillance, and also like monitor the climate change. And lastly is to embed the whole digital development into the One Health approach to realize the global health security. Because if we are able to comprehend our data sources and get data more timely, that means within a short period of time, we'll be able to accumulate a large amount of data. With the big data, that is more possibility to develop the global health security related artificial intelligence. And that will be the good for the human race, I hope. And we should try to develop this with the global good and having the transparency and trust built so that we can sustain the whole humanity in the new century. Thank you, everyone. And that's my sharing. Thank you.
Great. Thank you so much, Joseph. So if you have questions for Joseph, you can feel free to either put them in the chat or in the Q&A, and we will try to get through them. But Joseph, I wanted to kick off by asking you, you mentioned early on that miscommunications were a problem specifically related to the COVID-19 pandemic. How are you guys, one, sort of determining where that misinformation was coming from, or what was the strategy that the ministry took to try to address some of those miscommunications? I mean, I think that globally we're all dealing with miscommunications around the pandemic, and it would be really interesting to hear how the ministry really took on that specific issue.
Yeah, so again, I'm not speaking on behalf of the ministry, but just share our experience. So basically, when COVID started hit is the WhatsApp forum, which I mentioned, it is actually served as a virtual public health emergency operations center. We are supposed to monitor the situation and also capture all the rumors or misinformation as much as possible. And the good thing with the incident messaging application, which most popular in the country is using WhatsApp, we were able to collect the misinformation and then share in the group. And then it become like an incident to respond to. And then because with the EOC structure, we have different response pillar already in place, then people will discuss and through the virtual meeting, because like EOC, we during the outbreak, like a response mode, we are having meeting on daily basis. That is from Monday to Sunday. Every day we are in meeting and discuss how should we respond. And then the daily situation report, the CITRIP, would be published. And also the official statement will come out from the Ministry of Health. So in that way, we'll address some of the misinformation timely. And then also to communicate to the public, the key strategy we're using is the mass media communication. So that means we are not only restrict to one way of passing through the information, but multiple channels. So that include the TV, the radio, the WhatsApp message, the Facebook, and also the Twitter. So these are the way we're trying to address and also identify all the rumors or misinformation and try to respond to that.
Can you talk a little bit about where Malawi is in terms of the vaccination rollout? Have you guys started yet or anticipating starting soon?
Yeah, we already started. We are using AstraZeneca vaccine. In one of my slides, maybe I can try to go back to there. Currently in the country, we already administer 277,000 people that received the first dose. And the whole e-vaccination, I think one of my colleagues may share some of the information, I think Blessing, in one of the talk. So that is the progress we made. And also the e-vaccination, the e-vaccination module is also built on top of the One Health surveillance platform, which we use the DHIS2 as the solution, and then we took the vaccination module from WHO and the University of Oslo and customize it and use it for our digital solution to monitor the vaccination program. And also on our official website, though the data is not public, we also generate the dashboard to monitor the whole vaccination progress. And also like this one, this is for the public consumption. So it's like the daily dashboard for public use. You can see the vaccinated up to date is, that figure, 277,000.
That's great. Yeah. Are you finding any resistance or miscommunications around the vaccines?
Oh, yeah.
Yeah.
Oh, yes, definitely. Yeah. There's the blood clot issue, and people are saying, people are saying the government may use the expired vaccine, and that is why Malawi is the only two countries in Africa, that's Malawi and South Sudan. We destroyed the expired vaccine, although we heard some in unofficial communication saying the expired vaccine can still be used. But in order to make sure that the public has the trust with the government and maintain that trust, we just destroy all of them. And also the vaccine campaign and administration was quite efficient actually in the country. Yeah. So we just destroyed quite a very few amounts of the vaccine.
Yeah. Okay. So I have a question here from Takandwa. He said, "Hi, Joseph. Thank you for the presentation. How did the digital tools support the daily reports that are shared to the general public? And how have you optimized that over time?"
Yeah, thank you. Yeah, so to communicate with the public, basically we use the official COVID website. So if you type covid19.health.gov.mw, you will access the official website. So in the beginning, actually, we have a lot of digital development partners. They said they want to develop the website for government. But then we negotiate and make sure the government takes the leadership role. So in the country, we have only one official website to avoid any confusion. And in that website, we have of course, a one-page dashboard to know the country situation. But then if you check the menu, there's also public dashboard and also other internal use dashboard. So the public dashboard is where we have some more detailed analysis. Then apart from this one, the WhatsApp chatbot, the SMS, and also USSD service were also developed so that if public, they want to access this information, they can also try to interact with the different platform, or they can just call the hotline to get the information. And also the government is releasing the daily situation updates using the statement approach. And then on weekly basis, there's a press conference. And then the detailed analysis report before we publish it on daily, and now it's on weekly basis. And those are also can be found and published to the public.
Great. So just a couple of thank yous from the audience, from Amy Gottlieb, I think maybe one of your former colleagues. She said it's interesting to see how far Malawi has come with digital solutions. And Simon, thank you, Joseph. The presentation has revealed a lot of insights into the good work done in Malawi to counter the COVID-19 pandemic. One more thing that I think is just really fascinating is the concept of One Health and how you're really looking holistically at not only your sort of health environment structure, but how that actually translates into an information system structure. And you mentioned that really this had started back, I think you said in around 2017 in the post-SARS epidemic. Is that correct?
Well, the history is this. So for Malawi, how we start the whole One Health is when, I think beginning of the year 2010-11, when the government heard the term One Health, already started the Ministry of Health adopt the concept. And now is how we can realize it. So actually, the initial project that we work on is with another partner, local partner here called Bao Health Trust.
Mhm.
Together, we were doing the post-Ebola. It's the
Okay.
post-Ebola response, yeah. And at the time, we're trying to pilot and develop some electronic IDSR solution. And then that is where we learn some of the key thing about the whole surveillance structure and the flow and how the business is processing in the country. And then later on, we got a award from UNICEF to pilot a solution called Argus developed by WHO, which we're curious why we are not using DHIS2, but anyhow, we still pilot it. And that's where we learn how to deal and handle with the mobile solution for the electronic IDSR. And then that's how in year 2019, we come up with this architect framework for the whole One Health surveillance system architect. And that is taking into consideration both paper and also the digital. But still, we are still developing it, because if we look at this architect, you will see the environmental part. There's quite a lot of question mark. But the whole digital development in the country, digital health development in the country is quite clear, because we are standard compliance and trying to align with the global or national standard. So like for the HMIS or for the system, we try to stick to DHIS2, and also for interoperability, we're adopting the OpenHIE framework. So in that way, the data is able to flow. But the important thing now will be handling the whole business process and also the detailed know-how within the health and the surveillance domain.
And that must have, I mean, incorporating sort of the animal and the environmental workflows and you know, basically the subject matter expertise, that must have been quite new for the ministry in itself, correct? I mean, did you find that it was challenging sort of incorporating these entirely new, somewhat sectors into the Ministry of Health? And
yeah. Those are, of course, before the COVID is, we already know it will be very difficult and challenge. But COVID, we see it as an opportunity, because people will be more adapted to the digital way of dealing with the daily business, not only surveillance, but even like meetings and so on and so forth. So the acceptance is much better, but still there's a lot of work need to be done, because traditionally people are still stick to the paper way of doing business, having the paper register or writing things on piece of paper. So it will still need take some time. And the whole governance and also the leadership role from the Ministry of Health is very important. So for example, another experience we learned from this COVID is that with the surveillance, we managed to get quite a number of mobile devices to support surveillance work. But then with the vaccination program, we also developed a digital solution, but the resource for buying the equipment and the device is not there. So government take the leadership role to communicate with all the device owner for them to know all these digital mobile devices are for government, and although they are using for the surveillance, but now we are repurpose it to prioritize the vaccination program. And most of people, they accept, some they didn't. So that is something we trying to learn and trying to regulate the situation. And hopefully with this COVID, we'll be able to really enhance the country's system.
Okay, and so I think we have time for one more question. And I think you've touched on this, and I suspect I know what you're going to say, but what would you say are some of the key challenges to creating this very different workflow and very different data, making this interoperable across these different systems? Where are you finding the biggest challenges?
Well, I think the biggest challenge is people, they don't really like to change.
Yeah.
So how to convince people and then showing the value, like changing the way of doing business is really a benefit. That is the challenge part. Because in terms of developing the digital solutions or artifact, it's quite easy.
Right.
Relatively easy nowadays. Yeah, but for people to really change their behavior and really use it, use all the solution and use the data, that is something need more time to invest. And that is why how I deconstruct the whole success in Malawi. I put the human capital in there, because that is a very important aspect to make sure this can happen. Without that, it will be very, very, very difficult.
Yeah, as we like to say, the technology is the easy part, right?
Yes, relative easy.
Yeah, exactly.
Sure.
With enough time and money, anything can be accomplished, of course.
Exactly.
All right. Well, Joseph, thank you so much for joining us. This was such a great presentation. And thank you to all of our participants who stuck around to watch. Just a reminder, we will be taking a short break, 15 minutes. We are starting back at the top of the hour. You can always go to our the expo session if you want to see any of the pre-recorded other sessions that we have. We have a library there of other sessions you can watch. And we will see you back at the top of the hour. So thank you so much and see you soon. Thanks, Joseph. Bye.
Thank you. Thank you. Bye.